Prevalence of scurvy. Before we directly jump into the topic, let us know about scurvy. Scurvy is a nutritional disease caused by severe deficiency of vitamin C. Scurvy was first described by Hippocrates and is also known as the pirate's disease. Vitamin C or ascorbic acid is an enolic form of alpha ketolactone. It is a reversible reducing agent with a key role in reducing molecular oxygen, thus acting as an antioxidant. It consequently exerts an effect on many other compounds including copper, iron and folic acid. It inhibits a low density lipoprotein oxidation, hence reduces the atherosclerosis and improves the arterial stiffness, lipid profiles and endothelial function. Vitamin C involved in wound healing, dentition, osteoblast and fibroblast function. It affects neurotransmitter synthesis, prostaglandin metabolism and fatty acid transport. So now let us know about ascorbic acid storage in our body. The greatest concentration of ascorbic acid are found mainly in pituitary, adrenal, brain, leukocytes and the eyes. The chief sources of vitamin C are citrus fruit such as orange, lemon, kiwi fruit, spinach, mango, sweet and white potatoes, papaya, tomatoes, watermelon, etc. are the rich vitamin C food. Symptoms of scurvy present when plasma concentration of ascorbic acid is less than 0.2 mg per deciliter. This is usually calculated from plasma and leukocyte vitamin C levels. Scurvy present with follicular hyperkeratosis, coiled hair, gingivitis, dental caries, stiff joints, painful muscle, dry skin, and impaired wound healing. Symptoms may progress to fever, hemarthrosis, vasomotor instability, eventually lead to death. MRI shows sclerotic and loosened metaphyseal bands with periosteal reaction and adjacent soft tissue edema. Treatment is diet rich in vitamin C. Now let us see about prevalence of scurvy. Today, scurvy is much less common diagnosis and is typically seen in older adults who lack proper nutrition, especially a diet with limited intake of foods enriched with vitamin C. According to an article written by Anita Carr and Bals Fry, found in American Journal of Clinical Nutrition, stated that approximately 25% of adults in United States consume less than 60 mg per day of vitamin C and approximately 10% intake less than 30 mg per day. Consuming less than 10 mg per day can lead to the diagnosis of scurvy. The following population are increased risk for vitamin C inadequacy: smokers, infant fed evaporated or boiled milk, children with restricted diet, children with autism, developmental delay and cerebral palsy, sailors at sea for months, third world country with limited foods, individual with malnutrition, cancer, chronic diseases such as end-stage renal disease. Now let us take the research study on prevalence of scurvy in India. The age, sex and season standardized prevalence of vitamin C deficiency was 73.9% in North India and 45.7% in South India. In both North and South India, prevalence of vitamin C deficiency was higher in men compared to women and increased with increasing age. Finally, what we can conclude is, in socio-economic poor communities, as per many researchers, consideration need to be given to improve the consumption of vitamin C rich foods and to discourage the use of tobacco.